Welcome back to the Carlisle Med Gym. We are here with week 2 of our hip mobility series. We are in the midst of a global pandemic right now, but we still wanted to get you some things you can do at home, since if you're still boarded up at home, you can still exercise. So this week we want to go into some things on assessing hip mobility and how you can do some quick and easy self-assessments. As I talked about last week, hip mobility is a crucial thing to have when you're talking about keeping your low back healthy, keeping your knees healthy, making sure you're not overusing those pieces of your body for mobility when your hip actually should be the one moving. So today we want to talk about how you can assess whether or not you have enough hip mobility, and in the coming weeks we'll start getting into some specific mobility drills that you can do to work on your limitations. So we're going to go over 4 specific mobility assessments that you can do today. And again, as we look into this, it's important to remember that the hip is a ball and socket joint that is made to move in all planes of motion. So you got to be able to flex it, you got to be able to rotate it, you got to be able to extend it. And so we want to assess it in a lot of different planes of motion. So we're going to start here on the ground. And the first one I'm going to show you is an active straight leg raise. And this is mainly assessing hip flexion on one leg as you maintain hip extension on the other leg. And so I'm going to show you what it looks like, give you a little bit of criteria for whether or not you're passing this assessment. So come on over here to the doorway. For this one, I'm going to have you set up on the ground in the middle of a door frame with your knees lined up with the middle of the door frame. So as we set up here, knees lined up right with the middle of the door frame. It's crucial on the setup that you set up with palms up, hands out to the side, both toes flexed up so you're not just relaxed out to the side, and both knees locked out straight. So you want to make sure you're putting a little bit of a stretch on the back of your legs by pulling both toes up and keeping them together. So from here, it's a pretty basic stretch. Both toes have to stay straight up to the ceiling. Both knees have to stay perfectly locked out. You have to go slow so you can't just fling it up there. You got to go perfectly slow, locked out. Bring one leg up as high as you can while you maintain a straight leg on the other side. Pretty simple. If you can get your ankle past the door frame, you're passing. If it looks more like this, you have a little bit of work to do in this pattern. So again, on the other side, straight up, so you can get it past the door frame or not. I'm just passing. Number 2, we're going to go right over here to the mat, and we're going to look at a little bit of now hip rotation. So we showed you some hip flexion, hip extension, and moving in opposite directions there. On this one, we're going to look a little more at rotation. So we're going to look specifically at if you have enough internal hip rotation, so the ability to rotate your hip inwards. So to do this, I'm going to have you sit nice and tall on the ground. You can start with hands behind you, but as we go into the stretch, you're just going to bring one knee down and in, and one leg relaxed to the side. So you're going to rotate, turn your upper body that way, and I want to see if you can get to this seated position with no hands on the ground and be able to touch this knee to the ground. If you can do that, you have pretty good hip internal rotation. If you have to use your hand to get there, that's not so good. If you can't get the knee to the ground at all, that's even worse. So we want to make sure that you can get both sides, tall seated posture, knee to the ground, good hip internal rotation. Okay, so that's number 2. Number 3, we're going to come right up here to the table. We're going to do a specific test to look at your ability to extend your hip or drop one leg into an extended position. So how tight, in other words, is the front of your leg to resist hip extension? So we call it a Thomas test, but you're going to set up on the edge of a table. You can do this on a bed, on a table, whatever you have. You're going to lay back, hug both knees up to your chest. Make sure that one leg stays perfectly stable up against your chest or as high as you can get it, as you just relax the other one and drop it down. So you want to keep the knee bent and relaxed, and we're just looking for how far down that leg can go. So my right leg is just barely touching the mat. So if you can touch the mat or the bed that you're on, that's good. If you're kind of hanging up here, that means you got some tight muscles, a hip flexor, quad, that's not allowing you to extend your hip all the way. So that's something that you may need to work on. The last one we're going to do over here is set up on our chair. And we're going to look at hip external rotation. So we looked at a little bit of internal rotation. Now we're going to rotate the other way. And pretty simple on this one. Just want to have you sit straight up against the chair so you make sure your back is flat. You're not flexed forward like this. Flat back. Take one leg. First of all, can you or can't you cross your foot over the other leg? If you can't get there without pulling it up, that's something that you definitely need to work on. If you can get there, but your knee is not able to get down past about 45 degrees, then that's not so good either. And if you can get your leg passively down past 45 degrees, so about level here, or at least past halfway, that's a good sign of hip external rotation. So again, on this side, nice tall posture, being able to, first of all, just relax it down and then give it a little bit of extra push, see if you can get it down to close to horizontal. So that gives you a few ideas of hip mobility assessments that you can do at home that tell you whether or not you have at least a passing grade in some of these range of motions. And in the coming weeks, as I said, we're going to dig into a little bit of mobility drills that you can do to address these limitations. So take note of how well you did, which ones you were limited on, and stay tuned for more mobility drills.